health disparities have always existed for the African American community. But here again, with the crisis, how it's shining a bright light on how unacceptable that is. Because yet again, when you have a situation like the coronavirus, they are suffering disproportionately.
A grim reality beneath an already dire situation. And it isn't just African Americans who bear the brunt of this pandemic. The virus is exploiting America's deeply entrenched socio-economic inequalities. And the warnings are, it could get worse. Hello and welcome to Inside America with me, Ghida Fakhry. With the US death toll on the rise, recent data shows that the coronavirus is infecting and killing African Americans at a disproportionate rate. While they represent 13% of the US population, African Americans account for 33% of COVID-19 hospitalizations and 34% of deaths. With breakdowns of data becoming available in many states, racial disparities are becoming more and more evident. In the state of Kansas, for example, African Americans are dying at a rate 7 times higher than whites. In Missouri, Wisconsin, and Washington, D.C., it is 6 times higher. Now, already in early April, the White House had acknowledged this trend and said it was working to address it. But the disproportionate impact of the virus on African American communities is showing more than ever the extent of systemic racial disparities. And now, with more than 20 million jobs lost last month alone, the unemployment rate in the US is 15%. White House economic advisors warned that it could reach 20% by next month, with the unemployment rate for African Americans expected to reach 30%, and that is without factoring in the informal economy. So does the slogan, "We're all in this together," ring true, or does it mask a much harsher reality? Let's get an in-depth look with Marc Lamont Hill, author and professor at Temple University in Pennsylvania. Your books have explored the state of race relations in America, the shooting of unarmed Black men, whom you have called casualties of America's war on the vulnerable. Looking at the incidence of COVID-19 in African American communities today, could this open up a new battleground for race relations in America?
It could certainly open up a new conversation about race relations. The problem oftentimes in America when we talk about race and racism is that we're always looking or aspiring to colorblindness. And so at every instance, we try to find examples of how we're all in this together, which is the current narrative. We always try to find instances of how a crisis or a tragedy cuts across difference. But in this case, it absolutely doesn't. And so if we're willing and brave enough to point out the ways that this pandemic has played out differently along racial lines, along class lines, we can have a more mature and I think rich conversation.
But are we brave enough? Because looking at the data that's coming out, the aggregate data that breaks down the death toll by racial group, it doesn't exist for every state. I believe it's in 39 out of the 50 US states. When you look at the way the media has covered this side of the issue, and I know you're a professor in media studies, there seems to be an effort to gloss over some of this harsh reality. Is there a conscious effort to simply downplay or to ignore part of what's going on?
I wish I could say it were conscious, because then we could find and out the people who are, hiding the real narrative, and then we can move on with our mature, sophisticated lives. I think the more pernicious problem is that it's subconscious. We're not thinking about it. Our commitment is to doing this because we're conditioned that way. When you look at, for example, a place like Atlanta, Georgia, in the United States, where 80% of the hospitalized people are African American people, we see a racial difference. When we look in cities like New York, where the poorest people, who are disproportionately Black and brown, are still having to work the front line at restaurants, at convenience stores, at big box retailers, it shows you how even when we're ostensibly race neutral, the poor and the Black and the brown have to be on the front lines of this pandemic. That's a racial issue. When we look at the overrepresentation of Black and brown people in prison in a place like New York City, Rikers Island, and you see the infection rates at 54 out of 1,000 people, which is like 50 times any place else in the world, or most places in the world, you see these differences. It's not that we're consciously hiding it most of the time. Most of the time is that we just choose to not see it along racial lines. We just see Atlanta as really infected or Florida as really infected. And the fact that Montana isn't is just a coincidence.
But these disparities, though, have existed for a long time, haven't they? Disparities for racial minorities within the health system. The fact that Hispanics, for example, are 3 times less likely to have health insurance than white Americans. African Americans are twice less likely. Are these historical biases, historical inequalities simply not going away, or simply not going away fast enough?
They're certainly not going away fast enough. People talk about the great equalizer being COVID-19, and the only thing that differentiates us are pre-existing conditions. The pre-existing condition is racism. The pre-existing condition is structural inequality. The disproportionality in healthcare access that you mentioned is due to a differential in wage access. We live in a country where you only get health coverage if you have a job, and we are disproportionately unemployed or underemployed. That matters. All of these factors play into it. We're less likely to be able to see a primary care doctor, and so the emergency room becomes the only way we get treated, which plays into the pre-existing health condition. So all of this affects the outcomes that we're seeing now.
And this is what the CDC, the Centers for Disease Control, has been saying. It's been saying that there's been a disproportionate burden of illness and death among racial and ethnic minority groups. But it does point out to what you've just suggested, that it is, for the most part, to do with the underlying health conditions among some racial groups, the fact that they live in densely populated areas because of what they have called themselves the institutional racism in the form of residential housing segregation, the types of work some of these minorities do. This is what the Surgeon General has said on this as well.
The chronic burden of medical ills is likely to make people of color, especially, less resilient to the ravages of COVID-19, and is possibly, in fact, likely that the burden of social ills is also contributing.
To what extent are social ills also a factor?
If by social ills we mean unhealthy choices or bad choices, then it gets more complicated. One of the reasons that the U.S. Surgeon General, Jerome was criticized was because he not only talked about the structural parts of this inequality, but he talked about us eating better and making better health choices. And he told us to do it for our abuelas and our big mamas, and there was a way that the Surgeon General's response seemed to be victim blaming. It seemed to be suggesting that the way that we were going to find our way out of this or see ourselves out of this crisis was to just eat better and live better, more healthy, responsible lives. Those types of social ills that the Surgeon General alluded to, I think are deeply troublesome. Everyone makes bad health choices. Everyone goes to the movie theater, not me, but everyone goes to the movie theater and drinks a 64-ounce soda instead of the 12-ounce soda. Lots of people eat too much fried food. The difference is some people have the privilege and access to get second chances. Some have the privilege and access to see a doctor to get properly treated. Some have access to medicine to prevent some of this stuff, and we don't. And so when you start to shift the blame from a structural problem to one of individual choice, we're repeating the same cycles, and that's what stops us from getting real justice here in the nation. We're focused on what Black and brown and poor people could do differently with their diets, for example, rather than getting rid of residential segregation so that we could actually have social distance. I can't have social distance if I live in a house with 4 other people because we're trying to pool our income, and one of us has to go out and work every day at the local, big box retailer, and they potentially bring back illness.
You suggest the structural inequalities, and many influential African-American thinkers like Dr. Cornel West have pointed out the fact that America has always seen inequality and injustice, that they have been pervasive in American society, that is nothing new. What lessons need to be learned, though, for all of us to deal with this moving forward?
Right. One is that we have to move away from the narrative of color blindness, that laws, rules, and crises can be facially neutral, but they still have differential impacts on different people. We have to mature in that way. We then have to look at the structural factors that produce these inequalities, which is where the Surgeon General, again, was right. We have to look at what produces these outcomes. A pandemic comes once in a generation, But housing segregation, differential access to jobs, healthcare, housing, education, these things plague us continually, and they play out and magnify the crisis. And finally, yes, we have to, and this is where I disagree with the Surgeon General and Trump and everyone else, is that yes, we have to make better individual choices, but those individual choices can't be the excuse or the scapegoat for all the other stuff.
Marc Lamont, thank you very much indeed for joining us. The Navajo Nation is a Native American tribe in the United States whose territory stretches 70,000 square kilometers over Colorado, Arizona, New Mexico, and Utah. It has the third highest COVID-19 infection rate in the United States, just behind the states of New York and New Jersey. Its per capita infection rate is in fact 10 times higher than Arizona's. With just 12 healthcare facilities across their lands and limited resources, Native American tribes were promised $8 billion in direct emergency relief from the CARES Act. That is the $2 trillion bill that was passed by Congress on March 27th. It was only on May 6th, 6 weeks later, that the Navajo Nation received its portion of the aid, which is around $600 million, and only after suing the federal government. Let's put this in focus with the president of the Navajo Nation, Jonathan Nez. The Navajo Nation has one of the highest per capita infection rates in the United States. Just how much of a challenge is this pandemic proving to be for you and Native American communities in general?
We don't have the best healthcare infrastructure, but I think you see that throughout the United States of America too. I think there needs to be a lot more attention, a lot more focus on the healthcare system throughout the United States, and more so on the Navajo Nation. And I just mentioned, Ghida, earlier, that there are 18,055 of our Navajo citizens who've gotten tested. 3,204 have tested positive for COVID-19. 13,576 have tested negative.
But since you've been able to test more recently, have you seen an increase in the number of people infected, or is it actually slowing down? Because I know you were one of the first few people to actually put in place stay-at-home orders, to impose curfews, to lock down schools and businesses. Is that helping?
Yeah, I mean, these numbers would have been a lot worse in my view. Because of the slow response from the federal government, we weren't able to use much of the resources that were promised to citizens of this country, and no less the citizens of Native American communities. We have 102 deaths here on the Navajo Nation. And let me give it to you in perspective. You know, yes, New York, New Jersey, Navajo, and now Navajo's per capita the highest, but we are testing more of our Navajo citizens. Here's an example. 8.5% of our Navajo citizens have been tested. Throughout the United States, a little bit over 2% of the US population has been tested. So of course, if you test more people, you'll have, I'm sure, more positive test results come in. And so we are utilizing the resources that we have here on the Navajo Nation. We just recently received some of the CARES Act allocation. The money was given to U.S. citizens by 4 legislations that were approved by Congress and that was signed into law by the President of the United States of America. But the first citizens of this country finally received those resources after 6-7 weeks after the bill was signed into law. We tribal nations had to sue the federal government to get our share of emergency resources. And that should not happen here in Indian country or in a country as powerful as the United States of America.
But why do you think that delay did happen? You did receive $600 million, I believe, but as you say, after about 6 weeks at least. Meanwhile, this is what President Trump has been saying.
We're improving the lives of Native American families and tribes more than any administration has ever done by far. The administration is deploying the full resources of the federal government to support and protect our Native American communities in this very grave time of need.
So this is how President Trump sees it. How much support have you gotten from his government?
Well, we have been operating for 7 months, all 574 tribes, using their own money, using their own resources to combat this virus. And it is no wonder you're seeing a skyrocket in cases because we don't have the resources to help our citizens. But, I'm not going to be the one to say we're going to feel sorry for ourselves. We're going to take it upon us as sovereign entities to take care and protect our citizens. And that's why we have strict regulations out there that says shelter in place. And we're even putting curfews. We're using our own ability to govern ourselves and to help, slow down and stop the spread of COVID-19 here on the Navajo Nation. So if the president says that he's been giving the largest amount of dollars to tribes, that's the largest pot of money the U.S. citizens have ever received too. So let's keep everybody on an equal playing field. And I think everybody needs to recognize that the healthcare system throughout this country is inadequate. It cannot handle a pandemic at this level. And you see that throughout this country. And it's more so in tribal communities because the Indian health care, the Indian health services has been underfunded for decades.
Could the delay, the inadequacy of the health services, the aid that should come through from the federal government have to do with the fact that Native Americans, after all, represent less than 1% of the US population, and many would argue they do not really feature on the political radar of this country the way, say, African Americans do, that they do not represent a large voting bloc, certainly not in critical swing states. Could this have something to do with it?
No way. We're a powerful force. Everybody comes to the Navajo Nation. We're the biggest tribe throughout the country. And so we've been working with our congressional delegation, Republican and Democrat, to fight for Indian country. And the administration needs to understand that there needs to be some changes in regulation and policies that deal with tribal communities.
Jonathan Nez, president of the Navajo Nation, thank you very much for being with us on the show. Appreciate your time. Now, while much of the US remained in lockdown last month, Trump administration officials worked to speed up construction of the wall on the Mexico border by waiving federal regulations. The president has continued to tout construction of the wall while blocking immigration into the US, with senior White House officials using the nation's public health laws to deport asylum seekers. Trump has also put his son-in-law, Jared Kushner, in charge of overseeing construction of the wall, which is one of the main pillars of his re-election campaign. This, while the Immigration and Customs Enforcement Agency, ICE, continues to detain tens of thousands of migrants, many of them children. So how is the Trump administration using the pandemic to advance its anti-immigration agenda? Let's discuss this with Sharnya Krishnaswamy, Director of Advocacy for the Americas at Amnesty International USA. Sharnya, the first detainee suffering from COVID-19 died in ICE custody on May 6th in a California detention center. The US Senator from California has called his death troubling. She has asked for a hearing on Capitol Hill. How concerned are you about the conditions that detainees find themselves in across the US and the kind of medical care they are able to get at a time like this?
Amnesty International and other advocacy groups have been sounding the alarm for months now about the dangers that COVID-19 presents in immigration detention facilities. The fact of the matter is the vast majority of people who are there do not need to be there. Carlos Escobar, the man you just referenced, had a loving family in the US he could have been with. There was no reason for him to be in an immigration detention facility. He had a pre-existing condition. We've known long before even the onset of COVID-19 how dangerous these detention facilities are, how substandard the medical care is, how people with chronic conditions will be told to take some Tylenol and try to sleep off the pain, when in reality they need urgent medical assistance. ICE facilities have been deadly long before COVID-19, and now the conditions could prove to be absolutely catastrophic, as we saw just last week.
You say catastrophic, and Amnesty International just last month said that ICE, the chief immigration agency working along the border in these detention centers, had concealed and understated how many detainees have in fact been infected with COVID-19, and they have also worked to hide information about potential outbreaks from detainees themselves, from their lawyers, from the public. Is that still the situation? Just how transparent is the agency being with the data that it is collecting about who is infected and who isn't?
You know, ICE and immigration authorities in the US generally have operated with an utter lack of transparency and utter lack of forthrightness. Now, because a court has mandated them to, they're obligated to post statistics about the numbers of people who have tested positive for COVID-19 in detention facilities. And right now, that number stands at a little over 850 of about 1,600 detainees tested. That is a fraction of the tens of thousands of people in immigration detention. There are close to 30,000 people in detention facilities today, and ICE has only tested a fraction of them. And it doesn't report on the numbers of staff who often are contractors who are contracted to work at these facilities. And so the picture we have is still deeply incomplete, but even what we know is alarming.
And this is what someone working to provide some of the detainees with humanitarian assistance along the US-Mexico border told us just recently.
The impact of COVID-19 has been that the Trump administration has used it as a pretext to shut down the border to migrants, to asylum seekers, because there's at this point no way for somebody to enter the United States and make a claim for asylum. So people are being removed within about 45 minutes back into Mexico. And so if people are fleeing danger, as we've met people who are, and they want to seek safety in the United States, they have no legal ability to do so.
Is this pandemic then being used as a pretext to shut the border for migrants and asylum seekers, as Katie Sharar has said?
Oh, absolutely. We know from New York Times reporting that Stephen Miller, Trump's white supremacist, anti-immigrant, hardliner immigration advisor, has sought to use public health authority to shut the border to asylum seekers and children seeking safety long before COVID-19. You know, he tried it with the flu. He tried it with various other instances where U.S. practices were endangering detainees and asylum seekers. And now with COVID-19, the Trump administration has found its perfect excuse to do what it has wanted to do since day one, and that is shut the border to families, children, and asylum seekers seeking safety here.
So you mentioned Stephen Miller, one of President Trump's chief advisors on immigration, and there are reports, as you say, that he's been looking for a long time for ways to link his anti-immigration policies to public health and link them to migrants attempting to come into the United States. But Trump has vehemently denied this. He says this isn't about immigration. This is simply about strong borders.
We want to have strong borders. Look, I say it again, we want to have strong borders. I've been saying this for a long time, and I think people are agreeing with me. I really do. I think people are agreeing with me. The Democrats want to have open borders where people just come in. And you're not only talking about coming in from a crime standpoint, you're now talking about coming in with not only the disease that we happen to be talking about so much lately, but other diseases.
Is this claim supported by the data that you have seen?
You know, this is nothing more than racism, pure and simple. We've seen this for centuries where, you know, the government has sought to link immigrants to pathology, to diseases, painting them as disease carriers, when in fact it's the U.S.'s own practices of putting them in unsanitary congregate settings, detention centers. That's the risk. The way the U.S. responds to asylum seekers is the risk. There's nothing inherent about asylum seekers themselves. It's telling that the U.S. is leading in COVID-19 cases worldwide. Trump has absolutely bungled this pandemic response, which has had deadly consequences. And again, he's turning to his favorite scapegoat, that's immigrants and asylum seekers. And, you know, even this rhetoric itself has such deadly consequences. We saw last year when a gunman inspired by the words of xenophobia and of bigotry opened fire in a Walmart, in part based on that anti-immigrant sentiment. That rhetoric alone, even if it doesn't translate into policy, has deeply deadly consequences for all of us.
Sharnya Krishnaswamy, thank you very much. And so, as we've been hearing lately, we're all in this together. But are we really? Politicians across the US are using this mantra as a rallying call, but it does mask a different reality. While it is true that COVID-19 is affecting everyone, young and old, rich and poor, black and white, it is also true that its impact in today's America is much more virulent in some communities than in others. The socio-economic disparities have historical roots, and despite some recent advances, they remain endemic, structural. What COVID-19 has done is it has simply brought these disparities, these inequalities to the fore. Numbers don't lie, and the president, while largely criticized for his handling of the pandemic, cannot be solely responsible for the devastating death toll on African Americans, on Native Americans, and other minorities. So yes, in short, we're all in this together, but some more than others. Let us know what you think at _Inside America. For now, from me and the team here in Washington, thanks for watching.